Ben Danielson is the Senior Medical Director of Seattle's Odessa Brown Children's Clinic, which just celebrated Odessa Brown's 100th birthday and the clinic's 50th birthday. He is a clinical professor of pediatrics at the University of Washington. For decades, Dr. Danielson has been passionately advocating for equity for the most vulnerable in our populations. In 2008, he helped found the Washington Medical Legal Partnership, which helps people from underserved communities understand and secure their legal rights regarding safe housing, adequate schooling, medical needs, and more. Dr. Danielson co-chaired Washington's Office for Equity Task Force, which was intended to promote access to equitable opportunities and resources that reduce disparities. And he has served on the boards of many local health and community organizations. In September, Dr. Danielson was one of the community leaders participating in 12 Arguments for Change, the series of live virtual panels that envisioned an equitable post-pandemic King County that was convened by Executive Dow Constantine. He has been featured in the Seattle Times, King 5 News, The Atlantic, Crosscut, GeekWire, and many other news sources. I'm very pleased to introduce Dr. Ben Danielson as Healthcare for All Washington's featured speaker.
Well, thank you very much for that kind introduction. I'm very honored to be part of this gathering today, and I really look forward to listening a lot more than I speak. I did just appreciate this chance to share a couple of thoughts around equity. I kind of want them to be thought-provoking and encouraging of conversation rather than pulling through complete arguments or cases for issues. I want to share just the things I think about when we continue in this struggle for equity, this struggle that is transcendent of this moment, but so strongly informed by these times. I was going to just share a couple of points, and then I wanted to invite a conversation, a discussion, some questions, sort of see where that takes us. I'm really looking forward to this, and I just really appreciate all of you for all the work that you've been doing for a long time and will continue to work in this endeavor. I'm stealing your screen now. And wanted to just start this conversation with a couple of slides or information that I think about. So my thoughts about equity really started from where I get inspired and where I think we need continuing inspiration. And for me as a pediatrician, it often comes from the smallest packages in our society. I think about the courage that people show throughout history to see and do things that are unpopular, unappreciated perhaps at first, but that are ways that change the way our nation thinks about things. I think about Ruby Bridges, I honestly do, in this time today, because I wonder about the individual acts that maybe we are inspired to do to continue to work for change. I think about Ruby Bridges because I think about this image and the determination in the face of this very small person by herself, crossing a threshold, willing to do something that takes incredible courage and determination and dedication, even when the environment surrounding her is discouraging of these efforts. Think about the school dress and that satchel full of notes and that determined way she crosses into spaces that are unwelcoming. And that discomfort, that unwelcoming, that courage is really something that I think those of us who have more years under our belts really need to continue to see as points of inspiration. I also think about her role in naming and guiding a future and how predicated it is on the intersectionality in our society today. When we talk about anti-racism and equity and advancing the rights of everyone and addressing issue of socioeconomic deprivation in the way that our country foists it upon us, I wonder about how to be most effective in promoting health. And so for me, I'm really guided by this message that was given by a former Surgeon General many, many years ago. It's almost something written into our DNA in our clinic, which was really to the point that you can't educate an unhealthy child and you can't keep an unhealthy child educated. The idea of education and health are so intertwined, especially when you focus on young people. But I think more broadly, it's the thread that holds and pulls us through some of the most difficult challenges in our days. I wonder how you think about the intersectionality in the work that you do, the spaces and places where one cannot exist without the other, the dyadic and maybe the multiplicity of ideas like education and health have to be rights that are shared across broad swaths, that are relevant to each individual, and that are ways and paths to lift up incredibly bright futures. I think about these things around equity and how they don't stand by themselves, how what informs our well-being and our health is so powerfully connected to so many other factors. I've looked in my career, my training, at all of the technical skills that I've had to study and learn in medical school and residency. I've thought about the many ways in which skill and technical ability and access to technology and innovation are so incredibly important, how we lift them up in this country, especially around healthcare. And then I think about the lessons that I learned as a pediatrician in a community. And I would have to say that a nurse practitioner named Liz Thomas maybe didn't say these exact things, but she taught me this lesson, that when it comes to health and well-being, that it is really the intersection of these three factors that are more important perhaps than any others, that inform education, inform opportunities for housing, inform the ways in which our culture, our infrastructure is built, and the challenges of economic alienation. I would have said poverty, but I think in other countries, poverty actually isn't so harmful to your health in some ways. Toxic stresses, the things that we learn about as adverse childhood experiences, or the things that you know today around the day-to-day trauma and stress of existing in a time of coronavirus. And I think about racism and oppression. And it's important for me to make this point in this moment that although those things all overlap, they are completely separable. They are also completely distinguished from each other, so that we don't get to say that if we solve for economic alienation, that we automatically then solve for things like oppression and racism. And just to make that point really clear, I look at what happens in some of the most critical and important times in the process of developing and giving life in this world today, and in this country today especially. And I make the point that if you are a Black woman, if you are the most highly educated Black woman, the wife of a former president, or the greatest woman tennis player in our history, despite that economic access and all of the privilege that comes with that, your chance of dying and the chance of your child's dying in the first year of life after delivery are higher for you as a Black woman than they are for any other woman of any other race who has not finished high school. And my point is, economics and racism are separable. The same for stress. You can be rich or poor and face great amounts of stress. You can be rich or poor and face racism. You can be of any BIPOC or white race and face economic deprivation. These factors interact, but the deepest wound and the deepest issue in this country really is its 400 plus years of racism and how that informs the many other kinds of oppression that we face today. And I want to make this point about racism that I read in Ta-Nehisi Coates' book many years ago, which is that race is the child of racism, not the father. And what I hear from that phrase is that we created the construct of racism first. We built on the foundation of racism first, and then the ideas of race, which have no biologic principles built into them, were constructed in order to further the ideas of racism. This has been important to me to rethink the way I talk about things. For instance, I used to talk about differences in health outcomes based on race, or disparities and disproportionality based on someone's race. And that's actually a false statement that feeds into a false narrative. The truth is that we have differences in health outcomes based on racism. And we have disproportionality across many spectrums of our life based on racism, not on race. These ideas have to be the kinds of things we think about as we talk about and consider the issues of equity in our conversations moving forward. These times are hard, and they have this impact of a healthcare crisis, a health crisis, and also the impact of reckoning around an issue of violence against people based on the color of their skin. And I have to make this point that if I'm a good pediatrician, then I'm supposed to be giving advice about the things that are most risky, that pose the greatest health risk to the families I serve. And in a clinic like ours, then I have to recognize that for the young Black and brown adolescents and young adults who come through the door and come to our clinic, their seventh leading cause of death is being shot by police. That me, myself, as a Black man, have a 1 in 1,000 lifetime chance of dying by the gun of a police person. If I'm not incorporating the conversations about racism into the work that I do, even at the basic level of what is the anticipatory guidance that everyone needs to know about, then I'm not doing my job as a pediatrician. These factors are so important. Our conversations have to be so intense and so intentional. And I think that we cannot let ourselves off the hook at this point. I'm really worried about us losing focus on the issues of racism and equity in our lands. And I just want to warn you that the most important sign probably that we are losing focus on issues of equity is when we start to create jingles and commercials and create an advertising momentum behind them rather than a movement, a social movement of protest and policy change and activism. So when you start hearing a jingle from Coca-Cola about equity, you must be very worried that our energy and our focus has been lost. And I just want to say that the focus and energy needs to be there. It is so important that we are all part of that energy, that we can do things that are beautifully disruptive, that we can have an energy that is so beautifully disruptive that it knocks people off of their balance, that it creates a different dialogue, a different conversation, that we can show up in a way that is so powerful, so elegant, so irrefutable, so beautifully disruptive, that we can be part of that change, just like Ruby was so many generations ago. These are important topics and issues, and they don't just end at conversations or policies. Because what I observe as a Black person who's had to navigate and survive many systems of privilege and profession and white dominance is that I've had to learn how to do that without showing my full self, without being the angry, loud Black man, without being the person for whom someone finds harder to accept in their circles. And we need a future of diversity and presence in at our tables, at our places of leadership that really allows a Black person, a brown person, and an Indigenous person, a person of color to show up with their full selves, not with their code-shifted selves or their tempered selves or their attenuated selves. When we start to see that uncomfortable disruption from voices that are not familiar to us, then we will start to see real change. These are thoughts that I want to provoke and have you think about. I still think a lot about Ruby and the path that she took and the bravery that it took, but also that she was doing that alone and she was doing that in an adverse environment where the people who saw her wanted to jeer her. And what I see today is this different kind of promise. This is a school very close to where I live and where our clinic is. And what Black young people see today when they start the school year, at least back in those times when we could laugh and hug and cheer and high five and say hello to each other without the muffles of masks, is a welcoming of people who look like them saying, I see you and I celebrate you and you are part of this space just as you are part of every other space, that your belonging is unquestioned and is celebrated. And so I love the reference back to Ruby Bridges and her courage, but I also love the reference looking forward to a space where belonging is assumed, not asserted, that it is felt, not demanded, that it is part of everyone's life, not something that requires policy or guards or protections to enable. Those are some of the initial thoughts I just wanted to share with you, and I'm sorry for rushing through them, but I'm really more interested in what are the thoughts of equity that you have, what these ideas provoke for you, and I'm hoping we can have a bit of a conversation based on how these images and ideas have been striking you as an audience. Thank you again for letting me just open up with a bunch of ideas, throw them out there, and then listen for the conversation that comes afterwards. Thank you.
Dr. Ben Danielson, thank you for sharing those thoughts. My name's D.W. Clark, and I would guess I will start the Q&A. Do you feel optimistic as we go through this moment in time that we're all experiencing?
I feel optimistic by some signs and some people in some corners. I feel very worried that we are a short attention span society, that we'll move on to another issue, lose focus on equity. I feel very worried that we went through a time in the 60s when there was great upheaval, where in one summer, 21 plus cities were on fire, and that the movement of civil rights was in an intense phase. And yet, after all of that struggle, we're still back to where we are now, a time when Martin Luther King Jr. himself would be really sad and upset to see the divisions, the isolation, the withdrawal of rights, and the ways in which communities are oppressed so much. I will say one more thing, if I could. I also see that for something that I think is actually, on the whole, much smaller an issue than racism, and by that I mean the coronavirus, I see that our society was willing to make some incredibly deep sacrifices for an issue that is smaller in intensity than racism. We were able to wreck our economy in the name of addressing this coronavirus. And if we're willing to make that kind of sacrifice for something that is smaller in scale to the issue of racism, I guess it makes me wonder, maybe we really are ready to make incredible sacrifices for the incredible progress of addressing the issues of equity and racism in our society at last.
What do you see as the first priorities for seeking healthcare for all to begin bringing about equity in healthcare?
I would love to hear other people's thoughts on this. I kind of wonder, there's a constant ethical dilemma that I live in, where I feel at times like the efforts of incrementalism have been the enemy of great change and progress. So I wonder every day if I'm on the health exchange board and I'm helping to create what I think is a good experience for people to enroll in health coverage, but it is delaying us talking about universal health care. I worry about my complicity in that. Even as I believe that good work is happening in different spaces and places, I know that I'm a bit more of a revolutionary than I am an evolutionary person. And I wonder if we have forestalled progress by shining a light on increments.
I'm curious, have you seen any segregation in medical care for people of color?
Yeah, the evidence comes up over and over again in our nation. There's a study that's done maybe every decade that looks at 1 million emergency room experiences for children. These are all children who have come in and been diagnosed with appendicitis. And what the evidence has shown in ERs across the country, the ER that you go to, the ER that the people you trust and respect work in, the good-meaning people who don't think that they have bias, is that you are 80% less likely to get adequate pain medication for appendicitis and irrefutable pain if you are Black. The color of your skin drives the amount of care that you get, regardless in so many ways of people's good intentions to try to do good work. And that tells me also that the work of undoing racism and bias is not as easy as a stroke of a pen or an agreement among us to say, let's just not do bad anymore, let's just be good. There is healing and reparation and undoing that is so deeply built into our systems that it will take harder work than just good intentions.
I'm getting some great questions from our audience. Here's another one. My grandmother's hands has given me an appreciation for the degree to which Black bodies have been and continue to be treated differently in this white body supremacy system. Black people viscerally feel this lack of care and caring in their bodies when they encounter the system. How do you see rooting out this deep systemic bias in our current healthcare system?
I actually think that there are some roadmaps for that on some levels. I do think that reparation and healing is an important first step along this path. And I mean acknowledgement of the historic pains that are a shared acknowledgement across our society. I mean a true reckoning for the amount of wealth that has been built on the backs of especially BIPOC and Black communities, especially the land that has been taken from Indigenous people in order to work that wealth into the kinds of things that we're so proud of as a country. I think about the creating of enhanced opportunities for communities that have been so long left behind. And then I think about the ways in which that healing and reparation then can lead to some unlearning and deconstruction of the places where racism exists deep, deep, deep in our structures, and how we can create the tools. And I think there are tools out there that help you visualize and understand when those are showing up. Ultimately, I think we also then, in a third wave, simultaneously, but as a third phase, really need to change leadership from white, male, cis, hetero dominated voices to a much broader table. And it can't be just one person who is BIPOC or LGBTQ or represents an oppressed community at a table of other people who are oppressors. We really need to diversify tables with enough numbers that critical voice can actually rise up, that opinions can be shared freely without feeling afraid, and where people can show up as their true selves, as I mentioned in my brief presentation.
We have time for one more question. What indicators should we measure to see progressing in addressing racism?
Okay, so I have this dream indicator, and I would love to join with anybody who wants to come with me on this journey. I think our measure should be our measure of belonging. I wonder what it would take to find that measure, what the scope and scale and quality of that is. But I would love to spend some time working on creating a measurement of belonging. And I think that if we measured and held ourselves to this sense of belonging, which is kind of why I was showing the Ruby school entry and the school entry at the end, then we would really know that we are doing the right kind of work, and it would ground us in continuing to move forward.
Thank you, Dr. Ben Danielson, for everything you did for us today and for the work you do. I've had the good fortune to meet some of the doctors over there, and I'm inspired every time I do. Thank you very much.